For pathology and laboratory codes, in pathology areas, usually it follows about the same process as you would for the surgery section. You go with organ and disease panels is another area that you'd look here, and in those panels, you have to have all of the tests in the panel performed, or you're going to have to code them individually per test that you do. So, in other words, if there's um, a specific codes used, like let's say a thyroid panel you couldn't do just one or two tests and call it a thyroid panel. You say it's a thyroid panel, you have to do all three or four tests. If you want only one or two tests that's in that panel, then you would code them separately. Another area would affect the lab area is drug testing. Typically this is qualitative, um, looking at the type of food found, and then looking at quantitative to determine the amount of drug that's present overall. So separate codes for each section, um, and drug testing qualitative in the type of drug that's found, and then quantitative in the amount of drug present. So it's is it there, is it not, or how much? Coding in the medicine section, this is, and when they refer to as medicine, that's like internal medicine type practices. The codes are looking at therapeutic procedures, diagnostic testing that you would do in that area specifically. Um, they're similar to choosing a code uh, for a surgery area. So if they do a test, everything included in the test is probably going to be in that one charge. Immune globulins, you identify the globulin that's being used, and it has its own individual code, because it is a substance, mostly basically an injection type thing. And then you also do what method it was administered. So maybe you give an injection, but you also have to code the medication. Um, Hydration codes, this would be if you put in an IV for fluids, for instance. Um, and it's not, in this case, you're specifically indicating what fluids were used, not necessarily that you're not looking at that you infused a particular drug, you're looking at you infused fluids. In immunizations for vaccines and toxoid, um, in these cases, you have to list the exact vaccine that was administered. It has to be listed on the claim form. Um, so we're looking at only the vaccine type specifically. Um, Immunization administration is used in addition to the vaccine or the toxoid product code. So in other words, what did we inject is one code. That we injected is another code, so that you have two codes there. Home health procedures and services are usually done in the patient's home, but their home may become a nursing facility, extended care. It may be one of the group homes or some kind of assisted living that maybe is more of a just someone monitoring their health services. Um, these codes are used only for healthcare professionals that are not physicians. Okay, we've talked about diagnostic coding, we've talked about procedural coding. There is also another set of coding that is called Healthcare Common Procedural Coding System, or very commonly referred to as HCPCS. Uh, those codes have a 5-digit alphanumeric characters, have one letter and then four numbers. They may have modifiers, usually two number modifiers. Um, HCPCS manuals are divided into alphabetic index and tabular index, like the other two have been. So you look up the procedure in the alphabetic, confirm it in the tabular, and then it has a and it has and it appendix that contains all your modifiers and descriptions relating to the codes. Um, now, uh, they're updated annually also, and they may be used in addition to procedural coding. Another coding guideline is for ambulance transport. It ranges from A at the beginning, basically A21 to A999. But you have to have 4 digits, so that's the reason for all the other numbers. These are codes for medical transport. We sometimes have a patient transported from our office or to our office. These are typically non-emergency transportation. It can also be supplies used during transport. So if they had to use oxygen, for instance, that would apply here. Um, so anything used in the ambulance transport side of things. We talked about in procedural coding the surgery code charges. However, in the HCPCS, what you're looking at is doing the supplies for those. So this is where you might be looking at specific bandages or specific items that are used with that surgical procedure. So only the supplies we use can be billed this way. Um, all medical surgical supplies used should be documented on the encounter form and in the patient's chart. Remember, we've always got to have supporting data for whatever we do or charge for. Another area of HCPCS coding is durable medical equipment. Those come with a code of E100 to E1841. That is all of your assistive devices such as crutches, wheelchair chairs, walkers, anything that is something that isn't they refer to combustibles, for instance, anything that is not simply used and thrown away. Wheelchairs, walkers, those kind of things are used over and over and over again, and they can still be kept and used on another occasion if they needed to. But a lot of these are all intended at mobility. Another area of HCPCS coding is durable medical equipment. Those come with a code of E100 to E1841. That is all of your assistive devices such as crutches, wheelchair chairs, walkers, anything that is something that isn't they refer to combustibles, for instance, anything that is not simply used and thrown away. Wheelchairs, walkers, those kind of things are used over and over and over again, and they can still be kept and used on another occasion if they needed to. But a lot of these are all intended at mobility. We are responsible as medical assistants to be update on CPT coding, making sure that we are not doing inappropriate coding that could get into a situation of looking at a potential fraud issue. We're going to be using all the information that's in the patient's chart or that we have access to that is material that will give us documentation. And we also have to consider the results of what if. What if we don't do those things? Deliberately, and they use the term misrepresentation, deliberately saying something was done when it wasn't, or charging more than we should, or that kind of thing, or even charging less or coding less. All of those can come with criminal or civil penalties. We also need to be able to explain to our patient what the codes mean, what they're there for. If we look at the E&M codes, we can explain to the patient, why did this office visit cost more than the last office visit, for instance? Or what did we do in this office visit that made it a different fee, or those type of things. And we always want to do it with the friendliness and with the pleasantness of just trying to take care of people.